Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Hi everyone, it's Dr. Liz Kuo here. Welcome back to Digital MD Podcast. In this episode, we had an incredible conversation with Dr. Chinni Pulluru. But before we dive in, I wanted to let you know that there's an exciting update on our interview. Of course, Dr. Pulluru was kind enough to join us again to discuss the Walmart clinic closes, which significantly impacts some of the topics that we had. So please make sure to listen to the next episode titled New Insights with Dr. Chinni on the Walmart Health Centers. Let's jump right in. Welcome back to Digital MD, the podcast where we talk to leaders in the digital health ecosystem about innovation, decision-making, and how they think. I'm your host, Dr. Liz Kuo, and today I am thrilled to have Dr. Chinni Pulluru with us. So Chinni, thanks for being here. I'm eager to hear your take both on Walmart experience and Medicaid ecosystem. As we think about pinpointing challenges in innovation, you're just an incredible physician executive who's straddled everywhere from management consulting to serving and in a more inclusive, innovative environment at Walmart. And you have this really unique resume with medical education spanning a lot of global health. So I wanted to just ask, in your decades of experience, when you've built all these different policies in public and private sectors, can you tell me about what drove all of your different career choices? And can you tell me about your career moves and why you made them?
Sure. Hey, Liz, thank you for having me. It's been a while and I've always loved our conversation. So I'm really looking forward to this one as well.
I really appreciate that, by the way, because when we met, I will say from a personal standpoint, you were just very inspiring. And I think women should serve and help more women, especially in this field. So I just saw you as living and breathing that example.
Oh, thank you. And right back at you, by the way. I felt very inspired by you. You know, as a healthcare executive clinician, my career choices really were driven by so many of us draw off our personal experiences, right? You know, I grew up helping people get access to healthcare in rural India, with my dad, who's a physician. And then as I became a family medicine physician, our residency was really serving Medicaid patients, but in the middle of a very affluent area. So in the hospital, I sort of saw patients that had private health care and very well served. And then as a resident, I saw people who weren't so much. And so that disparity stuck with me, and it's really driven a lot of my choices. Being in DuPage Medical, I wanted to get into family medicine because family medicine to me felt like the trenches, right? It really felt that I would be able to develop trust and help patients and their families. Practiced for 15 years, which I have taken with me. I love the patient intimacy that I developed from that practice. And then growing up through various levels of leadership and going to Walmart eventually, it's the path not taken. And I think that's what's driven my career choices is how could I create access at scale? How could I really help the healthcare system? Drawing upon 15 years of practice and some of the things I've seen both in rural India and here, and seeing Medicaid patients and the disparity. And I feel, the dots connect in the future, as Steve Jobs said. And really, it's, all of those experiences were things that I've drawn upon in my healthcare career. But it's really about taking chances and going, the path not taken.
Yes. And when you take chances, can you tell me most recently where you're at and what made you choose to be on a smaller scale? You've done DuPage, Walmart, all these larger roles. What made you decide to sort of jump into the more startup space?
I really wanted to build. I felt that I built both inside DuPage and inside Walmart. I was in a role that essentially, drew order from chaos and sort of built and powered scale. However, it was nestled within a lot of support and a lot of people that I could depend on to sort of build the infrastructure. There's good and bad from that. I'm a scrappy girl. I love, I love bootstrapping and Band-Aid. I love being scrappy, building businesses. And that was a point of frustration sometimes in very large organizations. It's very hard to be scrappy. And I hope that that's what I brought to the environment. But I love what I do now because I do get to really build from that 0 to 1 and be scrappy and pivot, right? And really be lean. it also leads a certain amount of optionality to my life. And as a mom, as a woman, it's been really important to me at this point in my career. And I haven't had that optionality for 20 years. So it's great.
That is wonderful. I think it sounds like you also, when you're making these decisions, you're thinking about in the context of your life, whether it's like partners, friends, support mechanisms to allow you to still have a family and do certain things. How did you balance all of that when you're making these decisions to make sure that it's the right time for you making certain career changes?
Early in my career, I was very much wanting to establish myself, prove myself, make sure that, I worked hard, right? And I had 3 children during the course of putting in crazy work hours. And there came a point where I did decide I wanted to do a full-time schedule, but on 3 days a week. And I was fortunate that I was allowed that opportunity. And people stood up for me. It wasn't easy. There was resistance, but, other female colleagues of mine actually stood up and said, she should be able to do this. And I really appreciate that looking back.
Wow.
But I was able to, when I talk to people about work-life balance, I tell them, when you think about work-life balance, it isn't always at the same time. There's, you're not always balanced at a point in time. You hope that you're balanced over a period of time. So in a video versus a picture, right? And so any given moment in my time, if you found me, I probably would have been way out of whack in balance, whether it was with my kid or my job or profession, whether residency and putting the hours in, starting a practice. But I'd like to think that when I really needed to, I paused. And when I really needed to, I took the time or changed my environment, engineered my workspace in order to be able to give my kids and my family and myself what I needed. And that's what you have to pay attention to, is know when you're at the edge and know when to pull back and know when, your family really needs you. And I think, creating that transparency with your kids is important. And I hope that I did that to some extent.
Well, I guess we'll hopefully reap the rewards in a couple years when they're much older and they can tell us what we did wrong, but also hopefully what we did right.
Oh, yeah. Well, mine are older and they tell me what I did wrong all the time.
Do they really? Okay. I'm not looking forward to that. I also, I definitely want to go into some of your work experience because I think a lot of listeners would love to hear some of that. And I want to just boast about how amazing you are. But before I jump into that, I did want to ask you something that I feel like is relevant to this conversation, which is how do you balance being authentic, being a woman physician executive, being able to be serious, but also fun, but also humorous and aligning stakeholders to what you need to get done? And how did you manage all that with your own brand? Because I feel like that's something you and I have talked about a lot, whether it's being on boards or being recruited. How do you make sure that you convey what your value is, but also what your strengths are?
Yeah, I think it's really knowing what you show up as and having an acknowledgement of the fact that, you do have to be mindful of what you show up as. And I've had many points in my life where I've had guidance from people who've said, hey, course correcting, sometimes if I was showing up being feeling a little insecure, explaining for myself, right? And so that course corrections helped. But as a female leader, it is a balance. As a woman executive, particularly in healthcare, it's a huge balance. I've been in many rooms where I'm the only woman, and I'm a woman of color that as well. And, you have to lean back on your instinct of doing what's right. You might not be able to get away with the behavior that some men in the room might be able to get away with. And you have to balance that between being your authentic self, right? And I've at times had to make the choice between, do I show up stone-faced, completely buttoned up and, have that be my persona, or do I show up as me? And really
letting your hair down a bit, like making a joke or
down and letting people know what I'm interested in and the things about me that make me unique and my experience. And I think, if you show some of your vulnerability and show some of why you're driven to do what you're driven to do, that passion shows through, and it's always played well for me. And it's what I always recommend of young leaders is, especially women, executives is don't be so worried about being buttoned up to a point that people have a hard time relating to you, because
Yes,
everyone is
agreed.
surrounded by a woman in their lives, and it's okay for them to relate to you. Like, it's okay that people knew that I played soccer as a kid, or I did the, things that I did.
I love that. It's funny. So I show up to conferences usually, in a certain suit and whatnot. And I was in a lounge when I changed into a sweatshirt and sweatpants. And one of my team members saw me and they were like, "Oh my gosh, this is so refreshing. All I see is you dressed up." And
Yeah.
and I just look like a high school kid with a backpack. And so I find it's nice sometimes, like you said, to still be yourself and let people relate to you. So I love that advice. And there are times where, you have to dress a certain way in a certain boardroom and
Mhm.
it's the
And be
language that you
yourself.
use. Right.
Yeah, and I
So,
think it's really, it's really important for us at this stage in our career. We're both of us are a few decades or a couple decades in, and that people are watching, right? And
mm,
so we're setting an example for the people in the room that we're allowing for them to be a certain way because we are that way. And I think
mm,
that's an important thing to realize as well.
absolutely. So here I want to pivot and kind of boast about the amazing role that you had as Chief Clinical Executive and VP of Clinical Operations at Walmart. I learned about you actually through Judith McKenna, and who was this great CEO of Walmart International. And we talked about the expansion of what clinics were happening in the US and how Walmart Mexico and Central America was looking to do that. So you went from one clinic to 48 in under 3 years. You've built this great program. You also played a key role in the M&A team and acquired MedMD, a telehealth
Mhm.
company, and negotiated innovative partnerships with United Health Group and others and Optum for the full risk senior focused care, right? So could you tell me about all those roles and what you did in each instance to command that and to make sure that you were, like you said, yourself, but still able to, what philosophies did you have in terms of management and having that executive presence?
Yeah, no, for sure. Walmart, I was there for almost 5 years, and it was a fantastic run, a great company to be a part of, and especially being a part of the healthcare services part of Walmart was awesome. When I first joined, it was 2 months before COVID hit. And so I found myself at the sort of eye of the storm, right? One of two physicians that were in Walmart during COVID.
Mm,
And all of a sudden we were drawn into COVID response and opening testing centers and just running at a scale that was nothing like I've ever done in my life. But it helped me adapt very quickly to some of the core principles of how I needed to function at Walmart. Excuse me. Understanding that there is a scale to it, understanding the risks involved. All of that was baptism by fire during COVID. And that helped me when we started to expand clinics. I got pulled into operations because so much of my history was operating healthcare clinics.
mm,
And when we started to power and scale the clinics, there was so much infrastructure that needed to be built because it really was de novo. It was ground up. And, you know, I've I was amazed at how difficult it was to
mhm.
build a de novo healthcare enterprise from scratch, right? All of the things you needed to care about, all of the things, that didn't exist, the policies, the procedures. And so as we scaled it, I really drew upon my past operational experience and was able to sort of roll up my sleeves and get that done. But I found myself doing things I'd never done before, like looking at designs of clinics, looking at walls, how the flow of clinics should be and would be,
So I
looking at.
have to ask, like, how did you manage that when you've never done that before? Did you hire the right people?
Well, I was surrounded by the right people. So none of
Mm,
this you've done alone, right?
mm-hmm,
I was surrounded by an entire real estate team, an entire team that had built Walmarts and
mm,
pharmacies. And so, you're surrounded by the expertise. But the thing you realize pretty quickly is at the end of the day, you're a physician, you've practiced, you know how workflows work, you've done them,
mm,
right? A million times over. You understand innately how patient intimacy happens.
mm,
And there's things for example, I found myself looking at a room configuration, and the first thing that stuck out to me is that the physician should be between the patient and the door.
Hmm.
And I remember talking to our real estate folks saying, "Hey, we need to change this around because the physician should never be in a situation where they're not between the patient and the door, and therefore most of the time you want their movement that way." Well, I've been in a room where the patient went in front of the door between me and going out into the hallway, and it was very scary.
Hmm.
And so you draw upon
Did you
these
know that
experiences
improving
to just
preventive care can
understand what flow should
significantly
be like,
impact your
understand
health
the
plan
things you
star
should be
ratings?
mindful of.
Everly Health Solutions
I've
is the
used
leader in
those
at-home
flexible
testing for health
modules so
plans.
I could
Their
look at the TV
convenient,
screen and the
member-centric
patient at the same
approach
time.
has
And so
helped
I know
plans
that,
achieve industry-leading
you put
results.
those on a
In
wall
just
with
1
your
year,
back
Everly
turned.
Health
That's just not going
Solutions
to
helped
work,
a
right? And
multi-state
so
Medicare
you draw
group
upon a lot
improve
of
15
experiences.
of their plans
There's
by
so
at least
much you
1
learn
star.
from
That's a
being
win for
a
members,
clinician in
providers,
a
and the
practicing
plans themselves.
space
Learn how
that
Everly
teaches you
Health
how to operate.
Solutions can elevate your health plan at everlyhealthsolutions.com. So that's really, I think, fascinating. How were you able to scale so quickly with all the, was it kind of like a repeat model where now this is the structure? Can you like uproot and just kind of make it modular?
Yeah, and we did. So we used blocks to build modular clinics, and we were able to get clinics on the ground very quickly. But we had about 8 different versions of clinical footprint because we constantly relearned and we constantly analyzed, and that's a strength of Walmart.
Mm.
That I have to say, I learned that from Walmart because
Mm.
Walmart is a phenomenal company in how quickly it learns from itself, and how much they study errors and really look at how to improve and how quickly that improvement happens, right? That cycle is, I think, one of Walmart's greatest strengths. And it's something that I learned from being there because we iterated very quickly. We always looked at, how could we do better?
So I know we always hear about Walmart as an organization and how the insights that they have with data analytics. And I've oftentimes heard and talked to a few different people in retail, Kroger and others, where they say, interestingly enough, you can gather information, for example, on someone's eating habits, purchasing habits, whatnot, and then extrapolate. So someone that actually buys birdseed probably doesn't have as many car accidents because they can extrapolate to they have the same tendency to take care of a bird and or bird watch as they would their car, and they tend to like drive less. And so are there data insights and clinical insights that you were gathering as you were looking at Walmart purchases for your clinic or for the things that you were doing?
So in Walmart, the clinical care services is separated by a wall between the clinics in Walmart Health and Walmart Retail.
Mm-hmm.
So it takes a lot of and a very specific project for those two to interact, and they have to be done very compliantly.
Mm.
But I have interacted in enterprise level conversations that have to do with food is medicine, for example, or
Yes.
have to do with retail purchases of over the counter medications and how that might potentially lead someone for us to know that they might have a certain healthcare condition. And I've lent, some inputs into that data. And so the data is definitely studied.
Mm.
And, Walmart's very protective about how that data is used, making sure they're respecting the customer.
Yes.
But it's fascinating how much you can actually use that data and extrapolate and impute patient behavior based on it. And I really think it's the future of medicine. I mean, it's what you're involved in, and it really is the future of medicine to be able to look at that.
I love that. I also find, what you were talking about earlier about the clinical strategy to expand testing centers and the structure to develop a community health model. Could you tell me more about that? Because that I think is just really fascinating with the COVID response and how quickly you were able to move.
Yeah, and again, I'm grateful for Walmart in the fact that its huge strength is the ability to scale, right? I mean, if Walmart has a superpower, it's scaling. At one point, they were building, I think, one supercenter a week or two. I forgot, it's folklore. But when we first, when Doug first went on the White House lawn and announced that we would be in a partnership with FEMA and the White House to put testing centers on the ground, we had one on the ground in a week. It was in Illinois in my backyard. And I was able to partner to train 700 pharmacists within a couple weeks.
Mhm.
We were on site. FEMA had gotten delayed in Nashville. We showed up. We got everybody buttoned up. We had all of our protocols. We were, I believe, the second place in the country after Kaiser to put those on the ground.
Amazing.
And but what amazed me about that time and what taught me later on for Walmart Health is, as soon as I was out there buttoning people up, making sure, because remember, we didn't know how it was spread back then. So you had to be super
Yes.
careful. And I was making sure, everybody's hair was in a bonnet and whatnot. What I didn't realize at the time is that someone was following me, writing all this down, the little changes I've made, the little nuances, the things I was, maybe putting a rubber band around or whatnot. And then that night they sent it to me in a playbook. And before I knew it,
Wow.
the playbook was sent to the next 30 sites and
Wow.
nailed up. And
What a
that to me
great story.
is an incredible strength, right? And so
Yes.
as we pivoted to, scaling Walmart Health, the ability to just, iterate on the design and iterate on things, but at the same time, scale with speed and agility,
Mhm.
that's a real core strength of Walmart. And I've learned a ton from it is that they, but also that to make sure that you future proof. So everything is documented and everything, there are playbooks. There's things that you can produce that allow for the next person to follow your instructions, and it's not left up to your individual knowledge base, right? And that's what
Yes.
replicates things so fast.
So this is all really incredible because there are a lot of significant challenges that you overcame to get everything running. What were some, if you don't mind, going to a little bit more detail on that and how you overcame them? And also just thinking through, like, you've been innovating for so long in different underserved areas, which is such a huge also strength of Walmart, being accessible within 20 minutes for 90% of the population. And did technology play a role in this and innovation, and just hoping to hear your perspective on all of that?
Definitely. I mean, technology definitely played a role in our ability to sort of scale and put things on the ground and study our own data, right? As we
Mm.
started to study, you know, who's coming in, who's using us. So then we could actually tailor our services to the patients that are using us. So we started to really look at, what demographics, what patient populations were using us and what services did they need, and then adapt those services. But when it comes to some of the challenges, you know, it's very hard to start a healthcare enterprise in an organization that isn't used to healthcare delivery, right? It's
Yes.
healthcare is complicated at best, and I think some of the sort of compliance regulations that you have to follow, some of
Mm.
the risk that's inherent to healthcare, was something that it was challenging to. We had to do a lot of education internally as well as externally, because internally we had to educate the organization around some of the inherent risks and compliance challenges that we are used to. And
Hmm.
in a legacy organization, people just understand, right? And you move on. So that's hard. The second thing is really all of the systems, whether it be HR, understanding how to recruit physicians versus
Mm.
and dentists, right, versus retail workers. And then really looking at, marketing. How do you market to healthcare, and how do you,
Yes.
and so building up the processes and even simple things like how do you implement different conditions, making sure that we have everything in place when we're billing prior to opening a center, because we were moving so fast. And so there's such complexity to healthcare, and people don't quite realize even one clinic, what it takes to establish it. There's so many layers of things you have to add in. And that was
Hmm.
challenging. It was challenging to sort of educate people on that need.
Is there, I mean, this is sort of off the cuff, but I also see when you're building things in a large organization that has a huge P&L, whereas yours is important, but it's also not the largest P&L and still growing. How do you ensure that ideas don't get squashed before they have the time to flourish? And how do you also redirect resources if you're innovating in some area and you're thinking, this is not going to grow? We need to um,
Yeah.
clamp it down to prevent zombie projects from continuing that aren't going to be a good strategy.
So, I think failing fast is a concept that is often talked about at Walmart. It's
Mm-hmm.
try new things, and if you're going to fail fast at them and move on, and understand, learn your lesson and move on. So that helps. It actually is an advantage to be a very small part of the P&L in a very large company because you can experiment and they
Mm,
can afford to let you run with an experiment, right? If you were a larger part of the P&L, they couldn't afford to let you experiment to the degree that you can. You don't have as long of a timeline. And
mm,
healthcare takes 2 to 5 years really to get going.
absolutely.
It's not simple. And so, being a small part of the P&L allowed for us to continue to be funded and to
Mm-hmm.
continue to be supported. It was a huge part of the mission, and it was to get in, have healthcare. And I think, that's it. Having the backbone of a company that was able to fund that because it was so successful in other places was really important. The other thing, it is challenging though, because the flip side of that is, when resources become constrained, you're not the top priority. It really is what the core business is. And, I do have to hand it to Walmart that there was a little bit of a balance. We got a disproportionate amount of support than what our P&L would indicate that we should have,
Mm,
for things like marketing, for things like tech support, for things for like product, and really appreciate that vision was there. And it's really the leadership. I mean, you spoke about Judith. Judith's a fantastic leader, but
mm-hmm.
it really is about the leadership saying, we're going to take a long view of our investment and we're going to be okay with some of this in the middle.
Absolutely. What's also interesting, I'm hearing a lot of what I'm reflecting back on what you're saying is that you use technology, you spend a lot of time also figuring out how to fail fast. And Walmart has this great also service level where they are constantly tracking their NPS scores. And I know you are also reviewing a lot of the felt cared for a score under like this leadership of
Mhm.
yours. And you implemented technology to allow you to deliver sort of comprehensive care. I'd love to delve a bit more into that because I think a lot of healthcare entrepreneurs, and physicians and others, clinicians, are looking to venture into business side, but don't always know how to track that and or define what success is and or figure out how to think like a business person. What kind of advice could you give them when you're thinking about technology, thinking like a business person, and how do you basically scale things fast, like you've done, and fail fast, but also iterate?
Yeah, and I think one of the things that we did from the very beginning, we measured our NPS score. Obviously, we had the support of our consumer insights team in order to do that, which a
Mm,
lot of startups wouldn't. But finding a way early on to measure how you're doing and pivoting is really important. Our NPS score was around 80, even when we scaled. And that's really hard to do in healthcare. I mean, if you look at
yes.
the average specialist or primary care clinic, it ranges anywhere between, I think I've heard the numbers between 5 and 11 or 15. So it's super low, right? And
Right.
our cared for score was 96%, which is huge.
Oh my gosh. Yes.
And what that tells you is that you have to pay attention to what the consumer is saying, particularly as a growing business. And I've taken a lot of those concepts into our current startup as well as ensuring that the customer experience is front and center of what you're doing. Because if and paying attention, if you're not listening, the first 5 to 10 customers that we had in our startup, we actually went and asked them, hey, what could we improve? How can we do better? What are the steps that felt uncomfortable for you? And paid attention and pivoted. And we're going to continue to do that. I think really having line of sight into your customer and
Mm-hmm.
making sure that you're not shoehorning your idea into what you think the customer wants, but actually paying attention to what the customer is trying to tell you
Mm,
and going back and looking at the idea. So I know
very
Tom,
good.
Tom Ward in Walmart, and I remember
Yes.
he told me once, and he said it on stage as well, to fall in love with the problem, not the solution. And it's
Yes.
best pieces of advice I've ever gotten, probably in my professional life.
Absolutely. Walmart has such great talent from, Kath is now the CEO and president of Walmart International, Kath McLay. And I just feel like they're constantly drawing from talent across different departments. And it's really impressive. Tom, I think, came over from some of the acquisitions, and then now he's running all of the omni-channel. Um, I think what's really useful for listeners too, as they're hearing you, is to kind of understand how you've been thinking about it and how you learn from the different roles that you've had integrating technology, NPS scores now into your startup. We didn't have a chance to talk about your startup, but I love listeners to also understand, what are you doing now and what does your startup do?
So I co-founded a company with a couple of colleagues that is named My Precious Genes, and it's a genetic counseling company. And what we noticed was, the price of genome sequencing has gone down significantly, and it's driving more and more therapy. It's driving more and more therapeutic regimens. And thankfully, it's also being available commercially for people who want to look at their genome. What's missing is, there's the genetic testing, and then providers and hospital groups are often left kind of dealing with a 30 or 40 page report. They don't know what to do. And I remember being there, right? I remember being a family medicine physician, being handed something and trying to advise a patient on what to do from there. I've also been a patient of genetic screening without having genetic counseling. And so both I have a rare disease child as well as hypertrophic cardiomyopathy in my family. But no one's ever offered me genetic counseling through the whole process, right? And I'm a physician, I could figure it out, but most people can't. So the company that we have plays a role in between those two entities. It really is front-end genetic screening, so we can ensure that you're getting the right test. And do you really need the test, right? Do you really need to, what are you going to do with it if you're going to get it? And then as patients get the test, it's helping the patient and the physician and physician's office. So it's both understand what to do, interpreting it and being a point of contact, both for the patient, but also for the doctor, like being an easy point of contact to say, here are the recommendations, and looking at what recommendations have significance, because there are certain genes that are positive that don't have significance and aren't quite evidence-based recommendations yet. They might be in the future. And really looking at how do you differentiate between that and advise patients. And, the industry is growing, and we don't have that in between, that interpretation that allows that compassion to happen at a patient level.
Well, I'm really excited about where you're taking this. And I feel like it's a burgeoning market right now for insights to translate into sort of predictive, preventative, and then prescriptive in terms of what insights you're going to get to know what kind of treatment changes and or how you would actually modify what you're thinking about. So it's been an absolute pleasure, Chinni. I actually think that this is one of the more informative descriptions, not only of retail, but also of transitioning between roles. So I really thank you for being here. And before we wrap up, we always ask our guests for their hot takes on 5 key questions. So I wanted to just start and see if you're ready. The first is, what is the best advice you want to give anyone in their careers, in their life?
Embrace being uncomfortable. The more you can get comfortable with being uncomfortable, the more you will allow yourself to grow personally and professionally, take chances.
Great. What's your favorite business or life quote?
My favorite life quote is, "Let me fall if I must. The one I become will catch me."
Oh, that's a really good one. I'm going to use that.
Favorite quote?
Yeah, that's wonderful. What about the hardest challenge and how did you overcome it?
Gosh, it's probably motherhood, right? And I don't know that I've overcome it, but it's you do the best you can. You believe in yourself and you move on. I mean, motherhood's probably been the most difficult challenge of my life.
Also most rewarding probably too.
100%. Wouldn't change a thing, but it's also, you wake up every day and you just hope you're doing the right thing.
Yes. I love that too, because I don't always think I know if I'm doing the right thing, but I feel like everyone else is feeling the same way. So it's okay. No one has the perfect answers. What about what's most exciting for you about healthcare innovation right now? Sounds like your company.
Yes. The ability for technology to embed itself into workflows and
Hmm.
really drive access and efficiency, help physicians with their workflow and the burden that they're facing, but also drive patient access and really drive down disparities. I'm super excited about where we're going. I think we're at the most magnificent time in healthcare since I've been in it.
That is so true. The prior auth process, the different things that we have to do to document, to risk adjust, to code. I could see this being really helpful from generative AI perspective.
Yeah.
Discharge summaries.
The set of
Um,
tools that we're going to soon have is going to drastically change lives, both ours and the patients.
it's great. And hopefully free physicians, clinicians up to spend more time with their patients rather than having to do all the paperwork.
Exactly. Yep.
So last question is, if you could have any superpower, what would it be?
Gosh, that's a tough question, but professionally or personally?
Oh, personally.
It would probably be to know when to pull back
Hmm.
on the things that I want to do or the things that I'm pushing to do. Know how to decide.
That's so great. I feel like that's very efficient use of superpower, as opposed to some people say they want to fly, they want to walk through walls, they want to turn things into
Thinking
gold.
about my day, and I was just thinking, God, it would be great if through my career I knew, when to sort of take a step back and reassess what I was doing.
Yes, I,
What
I
would it?
think that's sometimes a hard skill set for people that are driven, and
Yeah.
so I really appreciate that. Well, Chinni, it's been such an absolute pleasure discussing all of the healthcare landscape, and your insights were really helpful and enlightening. So thank you for sharing. And I just want to say for the listeners, if you want to learn more about Chinni's work or connect directly, you can check her out on LinkedIn. We'll have both of the links in the show notes. We hope today's conversation has sparked your curiosity and inspired you to explore further. So thanks for joining us, Chinni. And until next time, keep on innovating.
Thank you, Liz.
Thank you. Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.